Bismillahirrahmanirrahim. Assalamu alaikum. Today I will talk about immediate treatment of anaphylaxis. So before going to the treatment, it is vital to know what is anaphylaxis, and if someone cannot recognize that child or this patient is suffering from the anaphylactic shock, then you will not treat appropriately properly. So it is important to know that this patient is suffering from anaphylaxis, because it doesn't mean that this child is having anaphylactic shock and he will come in the collapse state, or he will come unconscious or in coma. Sometimes children or patient can come by walk, but actually they are suffering from the anaphylaxis. So if you will treat at that time, it could be life-saving for the patient. So it is very important to know and to recognize that this is the anaphylaxis, and if you will treat appropriately, you may save the life. So what is anaphylaxis? Sudden onset, systemic life-threatening allergic reaction. So if you will see the definition, there is a sudden onset. These are the important words you should know. Sudden onset. In the history, they will give you sudden onset. The child or patient was very fine just few minutes before, but he became dyspneic, or he is having facial swelling, or he might is having a pallor, he is not feeling well, and then he collapsed. So it is a sudden onset, systemic life-threatening allergic reaction to food, medication, contrast material, anesthetic agent, insect, sting, or latex. Usually less than 5 years. Food allergy is very common, it's around 85%. And 1 in 1,000 of those allergies are life-threatening, and those are very fatal allergies, fatal anaphylactic shocks. So how they may present? They might have a circulatory failure in shock. So definitely if any child who is in shock, they might have a tachycardia initially, pallor, skin rash might be there, and they might have a facial swelling, difficulty of breathing. You might listen of how to know the difficulty of breathing. You might listen the sound of stridor, bronchospasm, it could be the wheezes, and rapid swelling of tongue, which can affect the airway of the child. So when airway will be affected, child is unable to take breath. So these are the things you should notice, but main thing is heart rate is very important to know. If any child who is suffering from any kind of allergy and his heart rate is very high, so it means child is going into the shock. So this child should be treated vigorously. So it could be the anaphylactic shock. Then you will see for other signs and symptoms. So other signs and symptoms of, if child is having a respiratory symptoms, any systemic symptom, then you will treat according to the condition of the child. So for example, if child is having widespread facial or peripheral edema with a rash, in absence of above symptoms, means there is no systemic problem, means child heart rate is normal, there are no stridor, no wheezes, there is no child is not pallor, only their facial peripheral edema, and widespread facial and peripheral edema and rash. In the absence of above symptoms, it is not justified that you will give epinephrine or adrenaline or hydrocortisone. Only those children or those patients need chlorpheniramine orally. So systemic involvement is important. You should be able to know that this patient is having a systemic involvement with the allergic reaction, so it could be anaphylactic shock. So what is the immediate treatment of a child who is suffering from anaphylactic shock? First of all, in any emergency, in any kind of emergency, if anyone who has collapsed, so we go for the ABC, airway, breathing and circulation. But in anaphylactic shock, if you recognize that this is the anaphylactic shock, you will give adrenaline first. Then you will, second step would be ABC. First step of your management in anaphylactic shock should be adrenaline IM, intramuscular adrenaline you will give. Sometimes we are providing EpiPen to the patient if patient is having recurrent anaphylactic shock. So those babies are needed to be provided two EpiPens, and even we teach them how to use these EpiPen to them, and also they use the bracelet so that everyone should know in the community that this child or this patient is suffering from the anaphylaxis. So if they become anytime, anywhere, if they are going into the shock, anyone can use this EpiPen. They should always keep with EpiPen with them. So adrenaline is vital epinephrine, which is very important. We first management immediate treatment is adrenaline IM. We'll discuss about the dose. It's age appropriate. Dose is by age. Then we will go for the ABC, airway breathing and circulation. Usually they might have airway edema. If they have airway edema, need to be called anesthetist because they need intubation. Because airway edema, you cannot do anything until unless intubation. Because if airway edema is there, they may have which can affect their airway. So they cannot breathe if they have the blockage of the airway. Then what you will do if patient is still suffering, you have given a one dose of adrenaline IM, but still patient is going into the shock. So at that time you may repeat the second dose of adrenaline after 5 minutes. So how do you know that patient is improving or not? Definitely you will check the heart rate, you will check the general condition of the patient, you will check the saturation, you will check that patient is going to be reversed from this anaphylactic reaction or not. So if patient is going to be reversed and he is going fine, then you will not give the second dose. But if patient condition is worsening or still the same, then you may repeat the second dose of adrenaline IM after 5 minutes. So during this time, if adrenaline nebulizer is available and patient is suffering from the wheezes, stridor, any difficulty of breathing, you may use the adrenaline nebulizer as well. So if patient has not improved and patient is inside the hospital, what should be your next step? Usually this next step is by the senior doctor, which is IV infusion 1 microgram per kg, 0.01 ml per kg in sodium chloride 0.9%, 10 to 20 ml over 1 minute. So max is 50 microgram, maximum dose of adrenaline which is 50 microgram per kg in infusion. Otherwise, intravenous adrenaline only in the cardiorespiratory arrest or in resistant shock. So what do you mean by resistant shock? Resistant shock means no response to 2 IM doses. So shock is, for example, hypovolemic shock, for example, diabetic ketoacidosis. They are having, they might present with the shock. So those shock and this anaphylactic shock is different. So this anaphylactic shock is, for example, it is because of some allergic kind of reaction. Then when we say resistant shock secondary to anaphylaxis, it means no response to 2 IM doses. So that's then we label it the resistant shock. In those cases you will give the infusion adrenaline, otherwise you will give IM. So what is the dose? Every doctor must remember this, because in case of emergency you are not supposed to open the book and check the dose. So it is very important to memorize these doses because of the patient. So up to 5 years, 150 microgram, which is 0.15 ml IM of adrenaline. 6 to 12 years, 300 microgram, 0.3 ml IM. More than 12 years of age, it is 500 microgram, 0.5 ml IM. So 0.1 ml up to 5 years, 0.3 ml 6 to 12 years, and more than 12 years of age, it is 0.5 ml IM. So this is the adrenaline dose. Any child you have recognized that this child is going into the shock and this child is suffering from the anaphylaxis, then you have to immediately give the adrenaline of according to the age dosage by the age, by this 0.15 ml up to 5 years, 0.3 ml 6 to 12 years, and more than 12 years of age, it is 0.5 ml, and you will give the IM, intramuscular. You will not give the IV. So during this time, definitely you will monitor the child, and if either child is improving or not. So you will wait for the 5 minutes, and you may repeat this dose of the adrenaline. Then you will go for the infusion. So this was the immediate treatment of anaphylactic shock or anaphylaxis, and it is very important to memorize the dose, and you should able to recognize how to recognize the anaphylaxis. So if you have recognized this child is having sudden onset systemic symptoms, and this child has sometimes their clear history after food, after insect sting or something else, or medicine. So in those cases you have to treat it vigorously, and you should think about that this is anaphylaxis. Do not forget to check the heart rate, respiratory symptoms, and the ABC, and then if any of this problem, definitely you have to give the adrenaline IM dose, and then you will monitor accordingly. Thank you very much. Assalamu alaikum.